First question. Which part of retina transform light energy into visual impulses? Option A RPE, option B ELL, option C NFL, and option D layer of rods and cones. The correct option is option D layer of rods and cones. Second question. Length of optic nerve is about. Option A 30 to 40 centimeter, option B 30 to 40 millimeter, option C 47 to 50 centimeter, and option D 47 to 50 millimeter. Correct option is option D 47 to 50 millimeter. Third question. At which structure of visual pathway optic nerve ends? Option A optic disc, option B optic chiasma, option C optic tract, and option D LGB. The correct answer is option B optic chiasma. Fourth question. Disconjugate symmetrical rotation of two eyes are called. Option A convergence, option B divergence, option C dextroversion, and option D none of them. The correct answer is option B divergence. Fifth question. Longest and thinnest EOM is. Option A superior rectus, option B medial rectus, option C inferior oblique, and option D superior oblique. The correct option is option D superior oblique. Moving on to the sixth question. Primary action of superior rectus is. Option A depression, option B adduction, option C abduction, and option D elevation. The correct option is option D elevation. Seventh question. Total length of superior oblique is. Option A 50 millimeter, option B 60 millimeter, option C 70 millimeter, and option D 80 millimeter. The correct option is option B 60 millimeter. Eighth question. Lifespan of each cilium is about. Option A 2 months, option B 1 month, option C 3 to 4 months, and option D 9 to 10 months. Correct answer is option C 3 to 4 months. Ninth question. Each orbit is formed by. Option A 2 bonds, option B 3 bonds, option C 6 bonds, and option D 7 bonds. Correct option is option D 7 bonds. 10th question. If an image is of same size and laterally inverted, it is formed by. Option A lens, option B spherical lens, option C cylindrical lens, and option D mirror. And the correct answer is option D mirror. 11th question. Which phenomenon is common in applanation tonometer, gonioscope, fiber optic light? Option A refraction, option B reflection, option C deviation, and option D total internal reflection. Correct option is option D total internal reflection. Next question. In which ophthalmic instrument prism used? Option A gonioscope, option B keratometer, option C applanation tonometer, and option D above all. Correct answer is option D above all. Next question. Prism used in ophthalmology for. Option A objective measurement of angle deviation, option B measurement of fusional reserve, option C diagnosis of microtropia, and option D above all. Here the correct option is option D above all. Next question. Bending of light rays caused by the edge of an aperture is called. Option A spherical aberration, option B chromatic aberration, option C diffraction, and option D refraction. Correct option is option C diffraction. Next question. The angle formed between the visual axis and pupillary line is. Option A angle alpha, option B angle gamma, option C angle kappa, and option D none of them. The correct answer is option C angle kappa. Next question. Functional hypermetropia occurs due to. Option A curvature changes, option B paralysis of accommodation, option C axial shortening, and option D none of them. Correct option is option B paralysis of accommodation. 17th question. Prominent eye, flatter cornea, large pupil and deep AC are signs of option A. myopia, option B. hypermetropia, and option C. astigmatism, and option D. presbyopia. The correct answer is option A. myopia. 18th question. Resting radius of curvature of posterior surface is option A 10 mm, option B 6 mm, option C 4 mm, and option D 2 mm. Correct answer for the question is option B 6 mm. Next question. Which is the most important stimulus for convergence? Option A hypermetropia, option B accommodation, option C diplopia, and option D above all. Correct option is option B accommodation. Next question. Excessive accommodation causes option A myopia, option B hypermetropia, option C pseudomyopia, and option D heterochromia. Correct option is option C pseudomyopia. Next question. Which treatment is usually not advised in bacterial conjunctivitis? Option A topical antibiotics, option B analgesics, option C dark goggles, and option D steroids and bandage. Correct answer for the question is option D steroids and bandage. Next question. Developmental cataract involves option A adult nucleus, option B infantile nucleus, option C both A and B, option D embryonic nucleus. Correct answer is option C both A and B. Next question. Skiascopy, pupilloscopy, or choroscopy is a name of option A ophthalmoscopy, option B gonioscopy, option C retinoscopy, and option D keratoscopy. The correct answer is option C retinoscopy. Next question. In which condition of retinoscopy patient can look directly into the light? Option A myopia, option B hypermetropia, option C undilated pupil, and option D dilated pupil. The correct option is option D dilated pupil. Next question. Ophthalmoscopy is a clinical examination of option A lens, option B cornea, option C fundus, and option D EOM. Correct option for the question is option C fundus. Next question. In indirect ophthalmoscopy, image formed is option A erect and virtual, option B erect and real, option C real and inverted, option D virtual and inverted. The correct option is option C real and inverted. Next question. Which structure keeps cornea and conjunctiva moist? Option A aqueous humor, option B vitreous humor, option C tear film, and option D none of them. The correct option for the question is option C tear film. Next question. Which wall of orbit involved in blowout fracture? Option A floor of orbit, option B roof of orbit, option C medial wall, and option D lateral wall. The correct option is option A floor of orbit. Next question. Volume of each orbit is option A 10 ml, option B 19 ml, option C 29 ml, and option D 39 ml. The correct option is option C 29 ml. Moving on to the last question of this video. Eyelids consist of option A 2 layers, option B 3 layers, option C 5 layers, and option D 7 layers. And the correct option is option D 7 layers. So please like, share and subscribe our videos. Thank you.